It is very nearly 8:25. Good morning to you, watching and listening to Breakfast with Stephen and Anne.
Yeah, now we're going to talk about something that is affecting a lot of young people at the moment, particularly because it's all to do with the new trend, and we've always seen it as a very healthy trend, for vaping.
Yes, because it's better than smoking.
Well, exactly. And a lot of young people are taking it up. Instead of taking up, they may never have smoked cigarettes.
See, that's
but
the
they're
thing.
sort of taking up vaping because it's the next thing to do.
It's meant to be a way of getting off cigarettes, not something you start up on your own.
Unfortunately, it's developed a whole trend of its own.
Yeah, it hasn't it? Anyway, a new study carried out at Tufts University School of Dental Medicine in Boston has found that people who vape are more at risk of developing cavities than those who don't.
Yeah, this is quite startling because the data revealed that 79% of vaping patients had a higher risk of suffering teeth problems as opposed to only 60% of the control group. That's quite a lot more.
It is. Well, here to tell us more is founder of Bespoke Smile, Advanced Dentistry and Academy. And got to say, because you've just become Vice President of the British
Academy of Cosmetic Dentistry.
So you are one of the top cosmetic dentists in the country, Dr Sam Jethwa. What do you make of all of this? Did you come across this before in your work?
I mean, it's a fascinating stat, isn't it? I mean, in the US study, there's a huge number of people who are vaping are much more likely to get cavities. And we do see vapers in my clinic. People will be motivated to give up smoking to achieve their dream smile, and a lot of our patients do give up. As soon as they leave the clinic, it's like, right, I want that healthy smile, I'm going to give up smoking. And they'll often pick up vaping, which Public Health England do actually suggest it's 95% better than smoking because of the lack of tobacco, tar. But what we don't know is the long-term effect. And that's where the research needs to continue.
Now, if you look at the flavours of vapes that are available, is it because vaping has a lot of sugar in it or something like that?
Well, that's what this study in the US did highlight, that the flavours may contain sugar. And there's an oral microbiome in the mouth, a collection of organisms that keep things balanced. If that gets disrupted by the sugar or the chemicals in the vape, it will change things. You might get more tooth decay or even gum disease.
And when you vape, you're filling your mouth all the time, for a long period of time, aren't you, with that sort of vapour?
And that long period of time is really critical because what I'm thinking in terms of vaping and what I'm seeing is it's an anywhere, anytime situation, whereas with smoking it's a slightly different thing.
Yeah, and what about, I mean, Anne talked about a lot of children vaping or younger people vaping. I mean, that's the problem, isn't it? I mean, you don't want anyone to have bad dental health. But if bad dental health is starting at a young age, then it's a significantly bigger problem, isn't it?
And this is the concern. You know, there's a worrying statistic. 8.9% of 11 to 18-year-olds in the UK in 2021 admitted to vaping either regularly or occasionally. And I speak to my GP colleagues and friends, and my wife is a GP in London. Recently, a patient came in, a 12-year-old, and said their entire class vapes. So
Hang on, what age?
12.
They all vaped?
Yeah. The entire class. So if that trend continues, and that stat is up double from last year, then we could have some health issues in our young adults.
Like sucking a sweet all day or something.
Yeah, it's the anytime, anywhere situation with the vaping and the lack of smoke. And it almost is advertised as something that is healthier than smoking, which isn't, that is true. But we have to kind of be aware that the stats aren't there yet, the studies are not there yet, we just don't know.
Where are we in terms of general dental health? Because a lot of we're in this financial crisis at the moment, right? And I mean, years ago, we were talking about poor dental health, particularly amongst young people, and not sort of being, in a way, not being taught properly by their parents how to look after their teeth. At a time when people are really short of money and perhaps aren't going for checkups and things in the same way, that's just going to exacerbate the problem, isn't it?
Prevention is always better than cure. You know, that's the message. And it can be in certain areas of the country hard to access an NHS dentist, and we know the challenges.
And the pandemic didn't help either.
Yeah, the situation overall isn't great for access. And so we have to try to get access, but also prevent. And it's about frequency of sugars, it's about not taking up habits that can encourage you to have dental health issues, and just staying healthy is really critical.
So, I mean, at least 2 of my sons vape. Should I be telling them, nagging them, to brush their teeth more?
Brushing your teeth is looking after the gums, and of course twice a day is ideal. You can overbrush because we can start causing wear of the teeth and things like that, so twice a day is absolutely fine, but it's important how to brush, and there's also the adjunct of seeing a hygienist.
But you said it's very important, this biome, did you say,
Yeah.
inside the mouth? The mouth has its own healthy level of
Balance.
bacteria. I suppose.
Bacteria balance.
Aren't
yeah.
you even disrupting that with brushing?
Well, the brushing is there to clean the surfaces of the teeth. So the mechanical movement is what it's all about. It's about removing that plaque and stopping it building up. And if the gums are inflamed, brushing well will clear that up. And that's what it's all about, really. So there's an old phrase, only brush the teeth you want to keep.
Yeah.
Gosh,
Yeah.
it's a good one.
But it's interesting, you say, amidst all of this, hygienist appointments. Okay. Now, how regularly should you do... Because, I mean, I have to say, I see my hygienist every 3 months, because you get a better price.
I do.
If you go every 3 months, you get a better... And I like to think
Okay.
they're being looked after.
Yeah.
And it's not
in
so
that way.
traumatic.
And it's not so traumatic. But it does end up getting very expensive.
Yeah, and I think the important thing is try to maintain a checkup if you can access it. It's very important. But if you can't access or you're not able to get in, and it's important to be preventative. It's the sugars in the diet, it's the brushing well, changing the head on the toothbrush every 3 months. If you have an electric toothbrush, there's sales on at the moment.
Well, I was just
now
going
might
to say,
be the
particularly
time.
at Christmas, our electric
Yeah.
toothbrush is good.
Now might be the time to get an electric toothbrush. Electric toothbrush is used well, manual toothbrush is used well, the result will be the same.
Yeah.
But I think an electric toothbrush can help people to achieve a better level of brushing.
It's because you can position the head in a way at
That's
the
right.
right angle and just maintain it, can't you?
That's exactly the message. If you put the brush into the right location, upwards 45 degrees into the gum line at the top, downwards this way, hold it, let the electric brush do its work, you'll get a good level of cleaning.
Oh, there you go, you say.
Well,
If you
good
didn't know what to buy someone for
Well,
Christmas...
yeah, and it's a goodie, that one.
It is a goodie. Dr Sam, good to see you. Thank
Pleasure
you
to be
very
here.
much indeed.